Dr. Eliya, you are an international expert in health expenditure and projection methods and health account systems. What are the lessons that South Africa can learn from countries with comparable challenges such as ours?
Thank you. I guess answer that in two parts. I think, first of all, it's important to emphasize there are very few countries which have South Africa's particular kind of health system. So there are actually no very comparable role models for South Africa to copy. Nonetheless, there are some general principles that we know from global experience over 150 years in terms of how to achieve universal health coverage. I think just two or three which I think are important. One is it can't be done without public financing. You do need tax resources to achieve universal healthcare coverage. Secondly, it's also very important to have systems to be able to control costs, and controlling the costs, the amounts of money we pay to doctors in particular, is very difficult unless there is some degree of state involvement in that process, and also the ability of the people who make the payments to use monopsony, to have essentially a monopoly on the purchasing side in order to set prices. I think these are the two important issues. We need public money, and we also need to think about setting prices. And
now, of course, the issue of public money is always a big, factor, and particularly in current global conditions. When you look at South Africa's expenditure for healthcare, how do you rate us? Are we spending enough money, but more importantly, are we getting value for our money?
I think the issue of whether it's enough it's not just a technical decision. I think it depends on what society wants to do, what your political economy thinks is appropriate. But if one looks simply at the data, South Africa spends about 8% of GDP, I think, on healthcare. That is a relatively high level of spending for a country at this income level. And that 8% is 4% public expenditure and 4% private financing. Both those components are also relatively high for a country at your GDP per capita level.
Now, of course, the South African government is committed to introducing the National Health Insurance Scheme. And initially, there was quite a lot of opposition, and the market, particularly private healthcare providers, were nervous that such an intervention, could impact them negatively. From your experience, what are the possibilities for public-private partnerships to ensure that the majority of citizens in any given country, receive universal healthcare?
Okay, two parts. You actually asked two questions. In terms of the national health insurance reform proposals in South Africa, I'm not an expert on the South African system, but what my understanding is that the current reform proposals are very more kind of indicative. They don't really provide the details to make a detailed assessment of what this will involve. I think they provide some directions for change over the next 10, 15 years. In terms of public-private partnership, I would say the exact kind of system you choose depends on where you start from. Countries have different systems because of their historical legacies. It is possible to have universal coverage, as I said today in the conference organized by the Hospital Association of South Africa. It is possible to have universal coverage with almost exclusive private for-profit provision. That's the situation in Japan, in Taiwan. And it's also possible to have universal coverage with exclusive public provision. That's mostly the case in the United Kingdom. And it's possible also to have universal coverage with a mixture of 50-50. So I think the details depend on where you start from, and then depends on the design of your scheme. But it's possible to get to universal coverage in different ways.
Dr. Ravi, just quickly as a last question, what are the prospects, just in terms of from where you're sitting, given that South Africa has such a unique set of challenges, what are the prospects for accelerating universal healthcare in South Africa under current conditions?
Based on my limited understanding of the system, I think one of the things that strikes me, it is going to be very difficult and very costly for South Africa to make a transition, and I don't think it can be done in a rapid time. I think that you're talking about 10, 15 years transition to achieving universal coverage at the minimum. South Africa has very particular problems which prevent a rapid transition. One is the very high costs of medical care in the private market, which I think is the effect of insurance, private insurance, and that means that it's going to be much more costly to bring the provision of healthcare in the section of the population who doesn't use the private sector to bring their care up to that level. It's going to be very costly and requires not only more money but also a large number of organizational changes.
Well, that was Dr. Ravindra Rannan-Eliya. Thank you so much. He is the director of the Institute for Health Policy in Sri Lanka.